This is Chapter 5, Module 2, the Dermis and Hypodermis. The learning objectives of this module are 1. Describe the components of the dermis. 2. Describe how wrinkles and stretch marks are formed. 3. Describe the lines of cleavage and how this would affect scarring during injury. And 4. Describe the structure and function of the hypodermis.
The dermis is the layer of skin just deep to the epidermis. It is bound tightly to the epidermis by the basement membrane. Deep to the dermis is the subcutaneous layer. The dermis is comprised of connective tissue that anchors the accessory structures of the integument, such as hair follicles and sweat glands. The dermis has two layers, the more superficial papillary layer and the deep reticular layer. The papillary layer of the dermis is made up of areolar tissue. This layer contains smaller capillaries, lymphatics, and sensory neurons. The dermal papillae project in between the epidermal ridges, making it a tight junction between the epidermis and the dermis. The bulk of the reticular layer consists of dense, irregular connective tissue and contains larger blood vessels, lymphatic vessels, and nerve fibers. As you remember, dense, irregular connective tissue contains both collagen and elastic fibers that work to give this layer of the dermis both strength and flexibility. The collagen fibers are very strong and they resist stretching, but they also bend easily to produce the flexibility. The elastic fibers permit stretching and then can recoil to their original strength after being stretched. The flexibility and elasticity of the reticular layer give the skin a characteristic called skin turgor. Skin turgor is the ability of the skin to be pinched or stretched and then recoil back to its original shape. Skin turgor is a sign commonly used by healthcare workers to assess the degree of fluid loss or dehydration. Fluid loss can occur from common conditions, such as diarrhea or vomiting. Especially infants and young children with vomiting, diarrhea, and decreased or no fluid intake can rapidly lose a significant amount of fluid. Fever speeds up this process. To determine skin turgor, the health provider pinches the skin on the back of the hand, lower arm, or abdomen between two fingers so that it is tented up. The skin is held for a few seconds and then released. Skin with normal turgor snaps rapidly back to its normal position. Skin with decreased turgor or poor turgor remains elevated and returns slowly to its normal position. Decreased skin turgor is a late sign in dehydration. It occurs with moderate to severe dehydration. Damage to the skin, such as sagging, wrinkles, and stretch marks, is caused by reduced skin elasticity. This type of damage occurs naturally through aging, though it can be caused or worsened by other factors such as dehydration, smoking, aging, hormonal changes, some medications, and exposure to UV sunlight. Wrinkles are an inevitable part of the natural aging process. As we become older, our skin becomes thinner, drier, and less elastic. Our skin's ability to protect itself from damage is also reduced as we age. Eventually, wrinkles, creases, and lines form on our skin. Apart from the factors mentioned above, a person's genetic makeup also influences how wrinkly we become and when and where wrinkles start appearing. Stretch marks are thickened tissue resulting from an excessive stretching of the skin due to pregnancy and weight gain. Stretch marks are a normal part of puberty for most boys and girls. When a person grows or gains weight quickly, like during puberty, that person may get fine lines on the body called stretch marks. Stretch marks happen when the skin is pulled by rapid growth or stretching. Although the skin is usually fairly elastic, when it is overstretched, the normal production of collagen fibers is disrupted. As a result, scars called stretch marks may form. Most girls and women have stretch marks, which tend to show up on the breasts, thighs, hips, and butt. Many women get them during pregnancy. And while they're more common in girls, guys can get stretch marks too. People who are obese often have stretch marks. Bodybuilders are prone to getting stretch marks because of the rapid body changes that bodybuilding can produce. Stretch marks also may occur if a person uses steroid-containing skin creams or ointments, such as hydrocortisone, for more than a few weeks, or has to take high doses of oral corticosteroids for months or longer. At first, stretch marks may show up as reddish or purplish lines that may appear indented and have more of a different texture from the surrounding skin. Most stretch marks often turn lighter and almost disappear over time. The collagen and elastic fibers in the dermis are arranged in parallel bundles running in the same direction. This allows the dermis to resist force in a specific direction. Cleavage lines are tension lines that establish specific patterns of the collagen and elastic fibers throughout the skin. These patterns become important when injury to the dermis occurs. A cut through the dermis that is parallel to the cleavage lines will remain shut and will heal well. A cut across the cleavage lines, or in other words at a right angle to the cleavage lines, will pull open and will not heal well, leaving a scar. Nerve fibers are also found in the dermis. Nerve impulses through these nerves control the blood flow to the skin and the secretions from the glands of the skin. These nerve fibers also communicate information from the sensory receptors to the central nervous system. They will transmit information about light touch from the tactile corpuscles located in the dermal papillae, as well as deep pressure and vibration from the lamellated corpuscles in the reticular layer of the dermis. Deep to the dermis is the hypodermis or the subcutaneous layer. This layer is not a layer of the integument, but is very much involved in stabilizing the skin. The hypodermis is made of connective tissue proper, and more specifically of areolar and adipose tissue. These tissues are connected to the reticular layer of the integument by connective tissue fibers. The hypodermis allows a separate movement between the skin and other underlying tissues. There are few capillaries in the hypodermis, and no vital organs either. The hypodermis is the site of subcutaneous injections using hypodermic needles. The adipose tissue that is found in the hypodermis is not deposited throughout the body equally. Hormones and age determine the distribution patterns of adipose. Men are more likely to have fat stored in their abdominal area due to the sex hormone differences. Female sex hormones cause fat to be stored in the hips, thighs, and buttocks areas. This ends Module 2 of Chapter 5, the dermis.